All right, everyone, thank you so much. I am very excited to be here. A special thanks to Pain BC and BC Children's Hospital for this opportunity. So today we're going to do three things. We're going to identify how pain is uniquely experienced and processed in children and teens. We're going to discuss how play can help pediatric patients to cope with pain. And we're going to list the knowledge, strategies, and tools available to make play a part of a pain treatment plan. Now I want to start off, it's the middle of the day. I think it's a great time to take a trip down memory lane. And it's just going to set the tone for us to think about play, which is a really fun and one of my favorite topics. So wherever you're sitting in your chair, take a deep breath. And you don't have to close your eyes, but I just want you to allow yourself to think of a positive childhood memory of play. So just take a deep breath. Just let that memory come, whatever that memory may be. Go into your mind's eye and remember what that moment was like in your childhood. Maybe just look around. Where were you? Were you outside? Were you playing on the street with your friends? Were you with siblings? Were you building a sandcastle on the beach? Were you riding bikes, climbing trees? So hold that memory in your mind just for a second. And I also want you to just dive into what kind of feelings you had during that positive play memory. Maybe you just remember feeling really excited, happy, joyful, calm. Maybe you were concentrating really hard if you were doing something in your play that you were thinking about. So I just want to connect to that memory and let that be available to you at various points as we go into this webinar. So as Jen said, we're going to talk about what a child life specialist is today. And I often get asked what that is, so I'll let you know. So in both healthcare and community settings, certified child life specialists help infants, children, and youth and their families cope with the stress and uncertainty of acute and chronic illness, injury, trauma, disability, loss, and bereavement. So we provide evidence-based, developmentally, and psychologically appropriate interventions, including therapeutic play, preparation for procedures, and education. And we do this so that we can reduce fear, anxiety, and pain. And this is from the Association of Child Life Professionals. I'll give you their website at the end of this. And we work with patients 0 to 19 years old, and we mostly are found in healthcare settings, but also in some parts of the community. And we work directly with patients, supporting their understanding, helping them to regulate their emotions, and focusing on their coping. So what is pain? There was a lot of different definitions that came up in my research, and it was very clear that pain is very difficult to define. And what I found was the International Association for the Study of Pain had what I thought was one of the best, and they sum it up pretty well in this sentence, that it is an unpleasant sensory or emotional experience associated with actual or potential tissue damage, or described in terms of such damage. For the purpose of this webinar, I want us to really focus on the fact that the experience of pain is not just about the physical, such as the actual or that potential tissue damage. How someone feels and interprets their pain is also based on a complex combination of factors from their social, emotional, psychological, and environmental context. No two people experience pain in the same way because of this. Pain is personal and it's subjective. That being said, pain is also universal because everyone has either already experienced pain in their lifetime or will at some point in their lifetime at varying degrees. And I think this is important to remember because this can make pain difficult to treat because we have our own experience and our own pain memories, and we can easily project our own experience of pain onto the person that we're treating if we're not careful and if we're not aware of the importance of their context and their experience. So it's really important to remember when treating children and youth because their experience of pain is unique to that of adults, and we're going to get into that, the reasons why. So pediatric chronic pain is a significant problem with conservative estimates that 20 to 35% of children and adolescents affected by it worldwide. Pain experienced in children's hospitals is known to be common, under-recognized, and undertreated, with more than 10% of hospitalized children showing features of chronic pain. What does this quote tell us? It tells us that children's pain specifically is not being treated properly, and it is a really important subject to be focusing on. We're going to go into child development now, and we're going to look at the different ages and stages that children and adolescents go through. And I really want to point out the point here that being a kid or an adolescent is hard enough without the added challenge of dealing with pain. And if you think about, especially chronic pain, all of the other factors that come into play when you're dealing with pain. So they're going through immense changes. They're developing their minds, their bodies, their personalities, and now they have all of these added burdens and barriers that are in front of them. And some of the impacts of their pain can actually carry through into adulthood. So I made this image because I really think that the multitude of challenges that pain brings into a young person's life is like adding weight to an already full backpack while climbing uphill. I'm going to go through the stages of development. So I'm going to categorize each age and stage, and we're going to look at how pain impacts them. And I'm basing this piece of the webinar off of Piaget's study of child development. He's a Swiss psychologist, and he was one of the first to divide development into stages. And I feel like his theory of cognitive development can really help us to understand pain. So this is where we're going to put in a poll question.
Okay, so I didn't talk about this at the beginning, but we've got a few polls that we want to launch during Claire's presentation. So if you can just, our first question is, infants process painful stimuli in their brains differently than adults, true or false? So please just click on the answer you think is true, and I'll just give you a couple more seconds, then we'll end the poll, and I'll announce the results, and Claire will give us the answer. So I'll give you 10 more seconds. Then I will end the poll. So there's still a few more people that has not. Okay, I think it's all slowing down. And I'm going to end the poll in 3, 2, 1. Ending the poll. And I'm sharing the results now. So Claire, 81% of people responded true, and 90% responded false. What's the answer?
The answer is actually false.
Wow.
Yeah, interesting.
Very, okay.
Yeah, so I'm going to go into why that is. I'll explain that a little bit. So our first group is infants. And infants are in the sensory stage of their development, according to Piaget. And attachment to their primary caregiver is the most important at this stage. And prolonged separation from the primary caregivers or the caregiver's failure to respond to the infant's needs can have detrimental effects at this age. When in pain, the infant turns to that primary caregiver for comfort and emotional regulation. This is the sensory stage of development, which means that the infant is gaining information about the world around them through their senses. They express their needs and wants through crying, And they will often have different cries associated with different needs. And a really important piece is in early infancy, they actually are not able to distinguish between wants and needs. That's why it's so important that primary caregivers respond to their cries when they happen. They interact with the world at first just through reflexes, and then later through intentional actions with the motivation to get a response from their environment with those actions. Understandably, assessment of pain is very difficult at this stage, and we rely on facial expressions and behaviors to tell us if the infant is in pain. So how do we understand the way that infants and adults process pain in their brains? Well, in a recent Oxford study, which was in 2016, they used functional MRIs to image the brain activities of infants and adults in response to the same painful stimuli. And just so you know, this was actually not painful stimuli that they wouldn't have otherwise had to endure. These were pricks that they had on their heel, which was for required blood tests. So just so you know that it was ethical. This study showed on these MRIs that the infant's brains lit up in much the same way as the adults' brains did. They also discovered that in addition to having the same reaction to pain as the adults, it appeared that the infants had a much lower pain threshold. The other interesting part of this study that I'd like to point out is that it also revealed that the brain lit up in response to that painful stimuli before the infant's facial expressions actually changed. So this tells us that even before we can see it on their face or hear them crying, the infant might already be in pain. Some of the things that we want to look out for with this age is if they're in pain, we might have them at risk for difficulty bonding with their parents, having distrust for others in their environment, which impacts their development, and then, of course, signs of developmental delay. So now we'll look at toddlers. And toddlers are in the pre-operational stage. During this stage, children begin to engage in symbolic play, and they learn to manipulate objects and actually make those objects symbols for other objects. They do not yet have an understanding of concrete logic, and their thinking can be irrational. So think about the tantrum that the child is having because they're not allowed to wear their favorite shirt that is in the wash. If you have a toddler or have been around toddlers, I'm sure you can relate to this. Toddlers are also highly egocentric, and they're only capable of seeing the world through their point of view. Pain is primarily a physical experience at this stage, and they can have difficulty distinguishing between the cause and effect of pain. They're also starting to develop fears of bodily injury and pain. They can have frightening fantasies. At this stage, immobility can be very challenging because large motor movement is a primary feature of this stage of development. So if they're injured, if they're bedridden in pain, it can be very difficult for them to cope with. And some of the negative pain behaviors to look out for would be that developmental regression, uncooperativeness, protest, despair, temper tantrums, and resistance. So 3 to 6 years, we call these preschoolers. And Piaget says that they're still in that pre-operational stage in this age group. And they're beginning to have imaginations and magical thinking. And what's important to know is that a preschooler, because they have such great imaginations, they will fill in the blanks of things that they don't know or understand with stories from their own imaginations. Pain can be internalized and perceived as a punishment for wrongdoing or a bad thought that they've had. For example, the child may associate their own misbehavior as being the cause of their pain. So they might think, well, I stole that toy from my sister and that's why I'm having this tummy pain. Or they also might hold someone else accountable for their pain, and they could strike out verbally or physically. They often associate doctors or nurses in the healthcare and the healthcare staff as being mean because they don't understand that they're trying to help them, especially if the interventions they're doing cause pain themselves. They also have difficulty focusing on more than one task at a time. So this means they actually respond really well to play as a tool for distraction. This is one of the most vulnerable ages for hospitalization for all of the reasons listed above. So distraction is really, really helpful. Some of the negative pain behaviors can be anger towards their parents, acting out, again, developmental regression. They're at risk for despair, detachment, and withdrawal. Withdrawal really means they're disinterested in activities they normally would enjoy. 6 to 12 years is the concrete operational stage, and we call these school-age kids. Concrete thinking brings in logic. Organized and rational thought are being developed at this stage. They can solve problems in a logical fashion, but they are typically not able to think abstractly or hypothetically yet, or to even see different perspectives or points of view. They kind of see the world as black and white at this stage. They can relate to pain physically and specify the location of the pain in terms of their body. They have an awareness of their body and organs. They also can fear bodily harm, and one of their fears is often body mutilation. This has a strong influence on their perception of pain and fear of pain. They're also starting to understand death at this stage, although the concrete thinking is sort of the extent of how they understand it. And then those negative pain behaviors to look out for would be if you're noticing an inability to complete tasks, if they're uncooperative, withdrawn, if they're angry, depressed, all of these can factor in. And also we might see some compliance issues at this stage, especially compliance with treatment. So the teenager is in the formal operational stage, and they're starting to understand consequences, and they have that hypothetical, abstract thinking. They can think about multiple outcomes of a situation. They're learning to problem solve, and they're using all of these hypothetical scenarios to kind of work out, well, if I did this, then this could happen, or if I solve the problem that way, that could be the outcome. However, they do not always have the required coping mechanisms to facilitate consistent, mature responses due to a still developing frontal cortex and hormone changes during this time. Emotions can change frequently, and they're not able to regulate them. If you have a teenager at home or work with teenagers, you can probably relate to this and understand this. They're also now able to imagine the sinister implications of their pain. So that ability to perceive the future, to think about all of the possible outcomes, can make pain really difficult to deal with. And pair that with the lack of ability to regulate your emotions, it can be a really, really tough experience for teenagers. At this stage, social connections start to overtake the primary caregiver relationships as the most important relationship to them. So obviously, pain in a social context is really important to factor in here. They're also self-conscious. They're aware of body image. They're aware that they're perceived by others, and they're thinking about how others are perceiving them. They're starting to develop an identity. They're thinking about how they fit into the world around them. Autonomy is super important at this stage, and they're really trying to assert it. If they're in pain and starting to rely on their parents again, that can be very, very difficult. So negative pain behaviors we might see would be uncooperativeness, so that non-compliance again. Withdrawal is really common at this age with pain. Anxiety, depression. Often see them arguing with their parents or those who are closest to them who are trying to help them. And then, of course, they're regressing to that, down to that more reliance on parents if they are dealing with pain or illness. So that's a really difficult thing for them. Okay, so play memory that we had. Bring that up again if you can, because we're going to start to talk about play, one of my favorite topics. Okay, so what is play? So play is an essential, natural part of childhood. It is important in its own right. Play facilitates healing, coping, mastery, self-expression, creativity, achievement, and learning, and it is vital to a child's optimal growth and development. Play is an integral aspect of child life practice with infants, children, and youth of all ages. And this is from the Association of Child Life Professionals. I love this quote, and I think it really summarizes what play can do for a child who's struggling with pain or illness. Play is one of the most powerful processes by which children regulate their experiences and their environments. Okay, Jen, we're going to the next poll question.
Okay, everyone should be able to see it now, so feel free to vote. The question is, the cerebral cortex, which is the part of the brain responsible for complex and higher level thinking, is where the urge to play originates in the brain. True or false? And I'll give you about 15 more seconds to get your vote in.
I'm curious about the answer for this one.
Okay, I'm getting a flurry of last minute voting here. I'll close it in 5 seconds. 5, 4, 3, 2, 1. Okay, I'm ending the poll and share the results shortly. So Claire, the audience was
okay
on this. So 62% thought the answer was true, and 38% thought the answer was false. What was the answer?
The answer is false.
Hey, these are tricky questions. Okay.
Yeah. All right. So I'll explain that one. Okay. So the title of this webinar is an intuitive approach to pediatric pain management. So why is play intuitive? Well, I really like turning to this incredible neuroscientist and psychobiologist. His name, and I'm going to say it right if I can, his name is Jaak Panksepp. So Jaak actually has a really funny nickname. He's known as the rat tickler. Okay, yeah, it's weird. I get it. Okay, so this is about Jaak. So he discovered that rats play together, much like children, as pictured here. He witnessed their engagement in play behaviors that involve wrestling, pouncing, and chasing each other. Okay, and he also discovered, which is how he earned his nickname, is that when tickled, rats actually make a sound, and he measured the sound and everything, and it's a sound consistent to that of a human laugh. Okay, so when you tickle a rat, they will laugh. So that's why he's known as the rat tickler. And this quote, I think, is wonderful. And it is, each species exhibits species typical play sequences, but still there's a self-similarity in the overall impression of a joyous lightness of being. That is the key here. So why is Jaak's discovery important? His research showed us that when he removed part of the brain, okay, so he actually went to these poor little rats, he took out their cerebral cortex. And we said that before. The cerebral cortex is responsible for that higher level complex thinking. He took that out. He watched the rats, and he observed that the rats still played in the same way that he saw prior to that part of the brain being removed. So that means he was able to identify play as one of the 7 primal emotions that originate deep in the center of the brain, the ancient brain structures that include the amygdala and the hypothalamus. This discovery meant that the part of the brain that gives us the urge to play is actually coming from the part of the brain where our instincts lie. This means that play is actually as natural and essential to our survival and our well-being as eating and drinking is. And Article 31 of the UN Convention on the Rights of the Child states that the child has the right to leisure, play, and participation in cultural and artistic activities. So not only is play essential, intuitive, but it's also their right. So let's look at play and the autonomic nervous system. So the autonomic nervous system has 2 parts. There is the sympathetic nervous system, which prepares the body for intense physical activity and is often referred to as the fight or flight response. the stress activation. The parasympathetic nervous system, however, has almost the exact opposite effect on us, and it relaxes the body and inhibits or slows many high energy functions. So parasympathetic is the calming part of our nervous system, and the sympathetic is the stress activation. So we know that stress and anxiety are associated with pain. This stress and this pain can activate the sympathetic nervous system and exacerbate our symptoms. The emotions that come with it will ultimately impact the quality of our life now and over time. And in a child, it can actually impact their development. So when we're constantly activating the sympathetic nervous system, and in a child, they're actually putting their development at risk, because they're constantly in that fight or flight mode, which has a lot of implications. So when we bring in play, on the other hand, activates that parasympathetic nervous system. So it provides us with the feelings of pleasure and relaxation, which decreases stress and anxiety. So we have this cycle, okay? So if we have a child in pain, they have stress about that pain, either the pain that they're experiencing right now or the anticipation of future pain. Then they have a physical stress response, and that can look like many different things. So clenching up, the heart's beating faster, they're shaking, all of these other stress responses can come into play. And that actually will increase their pain. And as you can see, it just turns into a cycle. So the goal of play is to break that cycle. Play can interrupt the thought patterns that cause children and teens to stress about their pain. Play provides an alternate focus that can decrease the pain experience by providing some relief from the psychological and emotional impacts of pain. For many young children or older children with developmental delays, children who are on the younger end of the spectrum, when we think about, what can we do to help them psychologically and emotionally with their pain? We think about meditation, we think about breathing, visualization, yoga, all of these wonderful things. These aren't really appropriate for younger children. So play can actually offer the same benefits. And that's what's really cool about it. Well, one of the many things. So play increases pleasure and relaxation, which means it increases their ability to cope with pain. It also decreases stress and anxiety, which means it decreases the negative behaviors and the non-compliance and the stress and the anxiety and so on. Okay, so let's dive into this concept of play, because it actually is a big one. We're just going to touch on it a little bit today, but we could do a whole series on defining play. So these 4 pieces are really important. In order to get all of the benefits of play, these need to be present. So play has to be intrinsically motivated. So the child desires to engage in that activity out of their own interest. Play is means rather than end focus. The focus is on the play itself. There isn't an end goal. We're not looking at the result. Play is also free from external rules. So there's a creative process happening, and there's a suspension of real life boundaries within a play context. So I put the word imagination in here. And of course, play requires active engagement from the child or teen. So they're participating fully. So all of that being said, when considering a child in pain, opening the door to play might mean setting up a game or activity that has a bit more structure or is initiated by the adult. But also, but when a child isn't feeling well, you know what? It's okay to do a puzzle. And a puzzle does have some rules, and it is a bit end-focused. But so I want to just add that in, and we'll talk about that a little bit more. But this is what we would consider true play. So this would be very important. So I'll explain it a little bit better here. So we have the spectrum of structured and unstructured, and we have the spectrum of non-directed and directed. So the horizontal line indicates how much external direction is provided to the child during the activity by the adult. So we have this spectrum, and then the vertical line indicates how much structure the activity itself contains. So whatever activity you're choosing, what kind of structure that activity has. So true play in its purest form, which is play for play's sake, is both non-directed and unstructured. So it's in the lower left quadrant of this diagram. So here's our true play. The child's controlling the objects and the concepts. There are no time constraints. The objects and themes are chosen to meet the child's individual interests. There's fantasy. It's voluntary. When we get into the upper right quadrant, we have the non-play. So this is not play. So the adult controls the objects and the concepts. They choose it. There's specific strict time limits. The objects and themes are chosen for the purpose of imparting a specific concept or imparting knowledge. The play has a duplication of reality, and it's a required activity. So a good example to demonstrate what I'm talking about here with this spectrum is I want you to think about a child building a Lego spaceship. Okay, so they have an end goal here of building the spaceship, and they follow a preset step-by-step instruction manual to reach that specific goal. However, once the spaceship has been built, when the child lifts it into the air and starts to make engine sounds with their voice and pretends to fly their newly built spaceship around the pretend galaxy, creating a story about where that spaceship came from and where it is going, they've now entered into the true play scenario. So basically what I'm saying is one isn't right or wrong. I would say the goal ultimately would be to be in this true play state as often as possible. And it's okay to fall somewhere in between. So maybe the board game that you're playing is structured, but maybe you're letting the child make up their own rules for the game. So it's not, you're not directing it. Maybe in my case, when I do healthcare play, which is playing with medical materials to teach children about the hospital environment, it's unstructured in that I might put the materials out for the child and they might play with a syringe or play with a stethoscope. But I might direct them a little bit in teaching them about what the function of that tool is. So as you can see, it gets pretty complex here, but the take-home message is, if you ever wonder if you're doing this play thing right, just remember what Yuck said, okay? The goal of play is to invoke a joyous lightness of being. If the activity is not pleasurable, then it's not play. If it is, you're on the right track. So what are some of the benefits to play? So play provides an alternate focus. We talked about distraction. I prefer the term alternate focus because it implies that the play is intentional. Distraction is kind of a little bit passive, I think. So of course, for the child in pain, it actually takes the focus away from their pain. It gives them something else to focus on. Play brings in a sense of control. In true play, a child has control over their choices, over their environment. When you're in pain, if you're going through treatment, if you're in hospital, you have no control. You don't have control over your body. You don't have control over what's happening to you. Play brings in that really important feeling of control and power. Play is a wonderful container where children can express themselves, express their feelings in a safe environment, in a safe way. It is comforting and it relieves anxiety. Just engaging in play, we talked about the parasympathetic nervous system, it's benefiting them in this way. For the healthcare practitioner, we get to build trust and relationships with children when we play with them. Entering into that play space with a child is a really unique space to be, and it has a lot of benefits. And it sort of builds that foundation for you to have a relationship with a child, especially if you're working with them and treating them. Because when you've played with them, they start to trust you. It facilitates the processing of stressful or traumatic events. Child life specialists, we work with children who have experienced multiple procedures, surgeries, blood tests, IVs, all that kind of stuff. And what we find and what we know is that when we play out those events in a play setting, they actually help the child to process and understand the event, and they take away the element of that post-stress and trauma. So they're able to actually work through their experiences, understand them, and they're able to regulate their emotions around them. And play promotes coping and mastery. So obviously, when we're playing, we're learning. And we can also use play to practice being brave. So I think we've hopefully all been with children when they're playing. And there's a lot of bravery play that you do see with kids that's really cool. Superheroes, rescuing people, so it really helps them to learn about coping with difficult experiences in a play context, and then also helps them to master things. So going back to the hospital materials, the healthcare play. Play provides a sense of normalcy. If you're in pain and you're in the hospital, you're in a very abnormal environment. Or if you're a child dealing with chronic pain or a teen dealing with chronic pain, you are in this abnormal place and you feel like you're not yourself. Play can bring in that feeling of normalcy again. We talked about play being pleasurable. And another great benefit to play is that it helps adults. So it helps all of us assess what is going on for the child. So for a child life specialist, play is a great assessment tool. But for anyone playing, really, if you're watching the child's play, you can really learn a lot about what's going on through the themes of their play. I would just really like to highlight that play is not something that we would implement in the place of other treatments. So it has its most therapeutic benefits when paired with the pharmacological and other treatment as part of a comprehensive treatment plan. So while play is therapeutic for pain, the barrier to engaging in play can be pain itself. So other interventions should always be utilized. So play is not a replacement for pain medication or sedation by any means, but it can help with the effectiveness of these treatments. And furthering that, so play and the pain treatment plan, these are really important elements to consider. So play is an essential, as we talked about, part of childhood and a teen's life, and it should be prioritized within any treatment plan or schedule. Time and space for uninterrupted free play should be made every single day, no matter what. So whether you're in a pain treatment plan or not, this should be happening every day. Play is a right, not a privilege. We know that the UN backs this up. And it shouldn't be used as a reward or taken away as a consequence. I want to stress that one, especially when we're getting into issues of compliance. Remember that play originates in the primal parts of the brain, meaning that we need play just as much as we need food, water, shelter. The play activity obviously should be chosen by the child. So if we're incorporating into a treatment plan, we want to make sure that that piece is, we might schedule in their day, physio, and then a chunk of time for play. And that at that point, we just say, what do you want to play, rather than presetting the plan. Playtime should be seen as separate from therapy time. Okay, therapy can be playful, and a lot of therapy is playful. But it is not the same as that true play like we talked about before, with no rules, no boundaries, no agenda, okay? And what are we thinking about in terms of the best way to approach a child when we're entering play? Okay, so these things are really important. Create a safe space and time for that play. So make the space. Make sure they have... they're away from, the stresses of every day. There's not going to be interruptions. As an adult, as I said before, we don't want to have an agenda when we're playing with the child because they're in charge here. We want to offer them choices and control, and we want to follow their lead. We are not the director. And of course, it's really important to be fully present and to be self-aware when you're engaging in play. And you know what? If you're not, the child will bring you back. They will point it out. So we're going to look at the different ages, and we're going to look at the best way to play with them. And I'm going to be having that angle of, the child who is in pain and or in a healthcare setting. So with infants, especially if they're in pain, but with most infants, we don't want to insist on eye contact. And this is a really important one because eye contact can actually be perceived as a threat, especially if a child is already in pain or in a stressful environment. So a really good way to get in with an infant when you want to engage and play with them is to interact with the parent first and show that infant that you're trustworthy. You could even play beside them and have a smile, engaged expression. Like the ones pictured here, these are all child-like specialists, by the way. This will entice the infant to watch you and want to engage with you. So it kind of, playing next to them, maybe not insisting on them participating in the play, but just playing with the parent or playing beside them. They're going to be curious and they're going to want to engage. Bring some enticing toys with you when you come in to play with the infant so that they can engage with the toy and you can build some trust. You might even want to offer the toy to the parent. You'll notice with infants and with toddlers, if you offer them a toy and they don't trust you yet, they won't actually accept the toy from you. When you know you're in, especially with that older infant and toddler, is when they actually offer you a toy. A really great toy as well is your hands, your face, and your voice. For infants, infants love faces. Infants are really drawn to people. Just be careful to watch how they respond and be sure that they're engaged. At this age, it's really easy for them to slip into the too much too soon and get overwhelmed. But you want to stay focused and engaged with them. So some toys that are really great for infants are rattles and shaker toys. There's one pictured at the bottom. Peekaboo and other interactive games where you're using your face and your hands. Rhymes and songs are wonderful for infants. And then we also like to have toys with textures and toys that they can put in their mouth. So we want to make sure that they're clean. I just have a really quick video that I want to share that has an infant. He might be around 1, I'm not really sure. But just a wonderful example of using play to help the child cope with pain.
Right. Yeah. Let's do mine. 1, 2, right. Yeah. Let's do mama's. 1, 2, right. Good. Daddy's got your arms. Whoa, we don't like this. What's that? A 1, a 2, a right. Good. Yeah. All right. Is it a 1, a 2, a right? Good. Yeah. Okay. Bend it. It's a bend it. We need tissues. All right. Let's get your Band-Aids. Hold on to that. Good. We'll get your Band-Aids. Let's say. Let's get this one on. You're going to take it right off. I know you guys. You take them right off. We'll take this and good. All right, clean up. Everybody do this here. Clean up.
Okay, I just think that is wonderful. And I think obviously this is the best pediatrician ever. It's important to note a few things. Okay, this doctor clearly has a trusting relationship with this child. So we didn't see the before, but he has put in some time to win the trust of this child. So I think that's really important because I think that if he had just met this infant and was approaching him in this way, he might not have had such a really warm response from the infant. He's also noticed that he's put the child into the arms of the primary caregiver. So if you didn't pick up on it, he was giving the child his immunizations. So those were needles that he was putting into his leg. He put the child into the arms of his father. So that's the person who can comfort him the best. And he's actually doing that for the procedure. So that's really amazing. His play approach, as you can see, he's matching the energy of the child. And this is quite nuanced. He can see that the child's a bit anxious and he's taking that anxiety and turning it into a bit of a game. He's also playing around with the child's anticipation. Anticipation games are great with infants. They love them. So do you remember how he was in the beginning, he was making that sound and that pop when he was showing it on himself and showing it on dad or on the mom? the infant really responded to that. But what he was doing is he was cleverly getting the infant to anticipate that stimuli of the ow. So he almost was helping the child to anticipate it so that they could cope with that painful stimuli. So he didn't overwhelm the child with his big movement and sounds because he was actually matching where that child was at. If that child was more withdrawn, more shy and quiet, that would not have been the best approach. But it worked here. And he's captured that child's attention, and he is fully present and connected with that child. So you can see that the child reacts to that painful stimuli with minimal disturbance, but he quickly returns to that joyous lightness of being state that he started with and comes back to engage with that pediatrician. Okay, so we are going to the toddler stage, approaches to play. So attachment is still really, really important at this stage. So make sure the parent is nearby or engage the parent as well in that play. Like with the infants, don't insist on the eye contact right away. Arrive with the toys in hand, maybe use the parent, same idea. Make sure the child knows your purpose is to play. This age group, they do a lot of exploratory play. They want to understand materials, textures, and function. The things that they're playing with, they're really experimenting with them. So this means, like, for example, I don't know if anyone's noticed, if you give a toddler some paint and a brush, the first thing they want to do is put their hands in the paint. That's because they don't actually understand. Like, think about it. You've been alive for 2 years. What is paint? Okay, how does this thing work? I want to pick it up. I want to squish it around in my hands. I want to get to know it. I'm not going to use paint as a tool to make a picture until I actually understand what paint is. That's why toddlers love to get messy. They also need to be the boss of their play. So follow their lead and allow them to exhibit their independence and control. If you see the photo on the right, you'll notice that that little boy is holding something in his right hand. It's a yellow and shiny plastic thing. That's called an arrow chamber. So Bernadette is our child life specialist here at BC Children's who works in the emergency department. And she uses play with toddlers who have to have treatment for asthma using this mask on their face called an arrow chamber with the puffer at the end. This is a really difficult one to do with toddlers, okay? So they have to be able to sit still and breathe in this mask that's over their face. So you can imagine that compliance can be really tricky. So she actually will sit down and spend time playing with them. They'll see, as you see here, she's got all these other toys around the child, and she's just put the arrow chamber in there and made it one of the toys and one of the things that he's able to explore and get familiar with in his play. And what's amazing is that typically after she has these play sessions, these kids are totally fine with this treatment. So some of the activities that you can use when playing with toddlers are cars, trains, trucks. Build it up and knock it down toys. Okay, so blocks are great. On the left, we have a water table, another great story. This toddler was retaining his or her urine, so wouldn't pee. Okay, what did they do? Bernadette came in with her water play, and lo and behold, that triggered the child to pee. So some really great things that you can do with toys. Little people are, the little toys that are in the shapes of people are great. Playing with medical materials obviously is really good. I really like syringe play as well at this age and the preschool age because they often have issues with taking medicine through the syringe. So incorporating those into play is great.
Claire?
Yeah.
Sorry to interrupt. We've just got about 6 minutes.
Okay. I'm pretty close. Yeah. Thank you for that update. So here we have our preschoolers, our magical thinking children. So they're figuring out their interests and their favorite toys. They might be a little bit hesitant as well when you come in the room. I find something called vicarious play works well. So playing in front of them, this child knows how they like to play with their toys. So if you come in and you start playing with the toys in front of them, they're going to probably be really tempted to correct you. So if they're nervous or shy, this age group will dive in when you start to play in front of them. So I really like that strategy. Obviously, dramatic play is a common theme. So building worlds and storylines. So as a participant, you want to be willing to step into any role that you're given in their play and avoid correcting any kind of misconceptions. If you want to correct them, wait till after the play. So playing doctors, action figures, dolls, play food, kitchen play. They love cash registers. Playmobil is a really good one with the little small figures. Arts and crafts and creative expression is really good for this age. And then school age, the 6 to 12-year-olds. So they really like to have a sense of mastery with their play because they've got that logical thinking and problem solving now. So crafts and projects work really well. Things that you can build on. So slime or Lego are really good. Make sure, of course, you're following their lead and that it's not too challenging. So they have that sense of accomplishment and mastery. So you don't want it to be too hard or too easy for them. And also games with rules are something that these children really like. And we have our third poll question, just quickly.
Sorry, if a teenager shrugs their shoulders in response to an invitation to play, it means they're not interested. True or false? And I'll give a shorter time this time. So 10 more seconds before I'll close the poll. And poll closing in 5, 4, 3, 2, and 1. Ending the poll, and I'll share the results with you. So 7% said true, 92% said false.
Nice. Yes, it's correct. It's false. Yeah. So with teens, what we find is obviously, I wanted to make sure I had some time to talk about this group because I get a lot of questions because obviously they can be a challenging group. So teens, it's important to pick the right time and be aware that sleeping in is actually a very typical and normal pattern for this age and necessary. So playtime is best happening in the afternoon or the evenings. With teens, persistence pays off. You might have to visit them a few times before they agree to play with you and they trust you, especially if they're in pain and they're feeling withdrawn or depressed. Be okay with sitting in silence with them a few times. Building that trust is the most important thing. Take the time to get to know them, have some conversations, ask them about themselves. Humor helps. Be willing to laugh at yourself. Okay, if our therapeutic clowns have taught me anything, it is that self-deprecating humor is a really great way in with teenagers. And then, of course, take anything that isn't a no as a yes. So most teens won't agree enthusiastically. So whatever you sign that you have that isn't a clear no, take that as a yes. So teens, I really like to do, all of the arts and crafts. We actually have a wonderful creative arts program here at our hospital. And, for teens, painting, clay, tie-dye shirts, collage, drawing and coloring, origami as well is a really great one. I like games like Hangman, I Spy, Mad Gabs is a good one, Pictionary, and then of course board games and card games. And just a quick example, so I worked with a boy with lupus who was admitted a few years ago with a pain crisis, 13 years old. And the nurses and the doctors caring for him were very, very concerned because he appeared depressed, he had a quiet demeanor, he barely spoke. He slept all day, he didn't interact, and I came probably 6 to 10 times and offered him activities and spent a little bit of time with him before being sent away every single day. And then one time, after many, many times of consistency, he actually agreed to do some syringe painting with me, and that went amazingly. And ever since then, he let me in. So with teens, be patient and be consistent. I've got a few of my top toys. So on the top left, we have the Hoberman sphere and the bubbles. The top two are amazing for cueing breathing, anywhere from 0 to 19. The Hoberman sphere actually expands when you pull it out, so it's visually enticing, but also it can be a breath cue for when it expands, breathe in. When you make it smaller, breathe out. And then, of course, we have a light spinner and a color oil drop. Those two are very visually appealing and distracting. So mycarepath.ca, that's a resource for teens. Jen was talking about it earlier. This is here to help these young people to get started on their pain journey and helping them to implement strategies right away to deal with their pain. So thinking about, there's wait lists. It can take a long time to get into, to see someone to get treatment for your pain, but they're dealing with it now. So this resource is a really excellent one for these young people to get started on their journey. I've listed resources here, and this is my email. If you have questions, or if you have questions about, or if you want me to send you any of these resources, please feel free to email me. I'm happy to answer any further questions. And then I actually can hopefully have a couple minutes to answer some right now if I can.
Okay, so thanks, Claire. That was fascinating. Really appreciate your presentation. I know we're at time, so many people will probably have to leave, but for those that can, please stick around and we'll just take a couple minutes. And if you do have questions for Claire, please type them into the Q&A box. Does anybody have any questions for Claire? I actually have a question, Claire.
Oh, great.
Yeah, I can start us off. So, because I'm thinking about my own kids, and when I take them into, occasionally we have to go to Children's Hospital, and there's always screens everywhere, Claire. We have procedures. So I wondered if you could just talk about the difference between using screens as a distraction and play.
That's a really good point, and you'll notice that I didn't include video games or iPads, and that was intentional. So I use screens a lot in the hospital setting. I definitely use them for procedural distraction in the moment. I find that they are very engaging and that they actually can facilitate really good distraction, especially for things like needle pokes or dressing changes, things like that. But what's different from screen time and what we talked about in this presentation with the true play is you're just not getting all of the benefits that you would get with that social interaction and that true play. So screen time, it gives us a lot of that instant hit, I'm instantly satisfied and I'm playing this game and it's giving me, I got a point. So our brain is getting those hits of dopamine really, really quickly. But what's happening is that that's actually not sustainable. So it can create and this is a whole topic in itself, but it can create a difficult pattern, and we can get stuck in, these young people are always relying on screens for that satisfaction. But when they engage in that open-ended play where they're interacting with someone, they're getting the multitude of benefits from that, that social interaction through the relationship. They're learning skills. They're starting to have a platform to understand their emotional expression. Emotional expression is you're just not going to get that with a screen. I hope that answered your question.
That's great. Yeah, no, thanks. That's really helpful. Okay, we do have one question. So Claire, what is a good long-term activity for a teen admitted for a chronic health issue?
Oh yeah. I really like projects. So if you're going to be admitted in hospital for a long period of time, it's really cool if you can build something that's going to have multiple parts. So what I've done with teams is we've built, a volcano and used paper mache and then let it dry, and then we had to paint it, and then we, eventually we made a little bit of a world, and then we eventually got to the point where we got the volcano to explode. So that gives them kind of something each day to look forward to, and it's this, play setup. The other thing I like to do is, recipes. So baking is a great one. And also I had another teen where we experimented with different slime recipes every day. So, we would go on the internet and we'd look for different recipes, and then it would be a fun experiment to see which one would work. But yeah, I would think if you know that this teen's going to be in for a long time, incorporate some play that's going to have that, it's going to go the distance for them.
That's great. Thanks so much. We don't have any other questions at this point, so I will just thank everybody for coming, and I'm just going to actually just quickly share my screen. Yeah, so I guess I just want to thank everyone for coming. I posted the evaluation in the chat, so if you could fill that out. It just takes a couple minutes and is really helpful for us. I will send out a recording of the webinar very shortly. Feel free to share the link with your colleagues who might be interested. And please email me at education@paynbc.ca if you have any questions or ideas for topics that you'd like to see. And once again, I just like to say thank you so much to Claire for sharing your knowledge with us today. That was so helpful and such an interesting presentation. So
thanks very much.
We will we'll see you next time, hopefully at the end of May. Thanks for coming.